Hi, my name is Gagandeep Gill. I'm here with United States University doing my MSN 572 head-to-toe assessment. I'm going to start off by showing my ID. Here's my ID, student ID for United States University. I'm going to set it back down because I don't have a thing to hold it. Here's my checklist. I'm going to go ahead and show a phone, the back part of a phone. I don't know. Okay, yes. Here's the back of my phone. There's a window. It's into a parking lot. It's very high. No one's there. I can't see anyone. This is just to show that there's no notes or anything hanging behind my phone. Which is my recording device. I'm gonna go ahead and put this phone on charge. Sorry. Okay. That's over there. Next I'm going to go ahead and do a 360 round view of the room. So 360 check. Here's the wall right there. That's the first wall. That's my patient. Here are all of my supplies I will be using. Here is my completely blank piece of paper. I'm going to use it as brain dump later. And then here is my itinerary, not my itinerary, my checklist that I will be putting away after I'm finished with it. So my second wall, this is the second wall. Here's the third wall, that's where I'm recording my camera right now. Fourth wall, here is a hallway door. That's another wall. That's an opening to the bathroom. Here are the floors. And I'm gonna go ahead and put the phone back on charge. Back in place. It's a little difficult to do this. Okay. Okay. And I'm just going to go through and make sure I'm not missing anything. I've already introduced myself. I'm in the MSN FNP program at United States University. I'm just going to introduce my patient and ask them their full first and last name. Can I get your first and last name?
Karen Gill.
Can I get your age?
18.
And are you the same person that gave me written consent to make this video?
Yes.
And then do I have your verbal consent to record this video? It's going to be uploaded on YouTube for grading purposes only for my instructor.
Yes.
Thank you so much. This exam is for fulfillment of an academic course and does not count as an actual or real physical. I'm going to inform you that if I find anything abnormal during this exam, that you should follow up with your primary care provider. I've already done the 360 scope. I've already done, I showed you all my everything that's around here. I've done the mirror check. Here's a visualization of my right and left ear. I don't have any earphones or anything like that. I'm not wearing any watches. Okay, so I think I've covered it all. I'm setting my consent down right here now, and I'm gonna go ahead and start by using my brain dump or writing my empty piece of paper. I wanted to stay in visualization of when I'm writing on this paper, so I'm just picking up this is an empty, like a frame that I'm using to write on my brain dump here. Okay, so I wrote down my brain dump. I'm setting this frame down right here. The brain dump is going back with me. I'm setting it down right here. Once again, I've completed my entire integrity check. I'm just verbalizing that I am doing a final attestation that I'm not using any external sources. I'm not using any outside help. I don't have anything on me that I can use. And the code of conduct for the United States University. This is my brain dump right here. I have it sitting right here. That's the only thing I'm using. I'm gonna try not to use that either if I can, but that's the only thing I'm using. I just wrote the notes on there and I'm setting it down, and I'm going to start off with my assessment now. So I think I've gotten everything that completed. I'm gonna go ahead and just wash my hands. And can I have you sit right here, please? And then I'm gonna have you just take off your glasses. Oh, sorry, take off your jacket as well. I'm gonna sit right next to you. I'll put my paper down. I'm just gonna start off by asking you a couple of questions about yourself. Mm-hmm. Can you tell me your first and last name once again?
Karen Gill.
And your date of birth?
03/17/2004.
Okay. And then where were you born?
Bakersfield, California.
Okay. Do you have any chronic illnesses?
No.
Do you have any allergies?
No.
Are you taking any medications?
No.
In case of the fact that she was taking any medications, I would ask her the dosage, the reasoning, the timing, and the name of the medications, and basically the purpose of them. Before that, what are you here for today?
Just a regular physical.
Okay, like an annual exam,
yes.
Checkup? Mm-hmm. Okay, in case she was here for a focus exam, I would ask her what the, I would ask her in the old carts form, the onset, the location, the do like a focus assessment, onset, location, modifying factors, any content, basically of the the issue that she's here for. Next, I'm gonna go ahead and just ask you, do you have any allergies?
No.
Okay. Have you ever been hospitalized for anything?
No.
Okay. When was the last time you had your physical exam? Your annual checkup?
6 months ago.
When was the last time you got your dental exam?
2 weeks ago.
When was the last time you got your eyes checked?
Last week.
Okay. So in this, she's recently got all her exams, so I'm not going to give any educational or, feedback on that. Anything abnormal in any of your exams?
No.
Your dental exam, your eye exam, or your annual exam?
No.
Okay. You're female, so I'm going to ask you, when was the last time you had your last menstrual cycle?
Last month.
Okay. Was it normal? Is it heavy? Is it light?
It is normal. It's 7 days long.
Okay. Do you experience any abdominal pain or cramping?
No.
Any body aches or any fatigue when you're on it?
No.
Do you feel like you have excessive blood loss?
No.
Okay. So that completes that. I'm gonna go ahead and ask you, do you do like a breast exam on yourself?
Yes.
Okay. What do you look for?
Lumps, anything unusual.
Okay. And have you found anything unusual?
No.
Okay. So it's really important that you do like when you're in the shower or even once you get out, just kind of do like a breast exam on your breast. Feel for any lumps, any cysts, anything abnormal, any discharge, things like that. Okay. Are you in any kind of pain right now?
No.
Have you ever been diagnosed with any kind of chronic illnesses?
No.
Have you ever been diagnosed with any kind of infectious diseases like TB, tuberculosis, hepatitis, or HIV?
No.
Okay. Have you had any change of vision or hearing loss?
No.
Okay. You said you've had no hospitalizations. Have you ever had surgeries for anything?
No.
Your immunization records, are they all up to date?
Yes.
With right now being COVID, in COVID season, have you had your COVID vaccines?
Yes, 3.
All 3 doses. Okay. And then have you had your flu vaccine?
Yes.
Okay, perfect. So all your immunizations are up to date. You don't have any current, health issues. No. So I'm going to go ahead and ask you, do you have any psychiatric issues?
No.
Do you have any depression, anxiety, anything you're dealing with that's taking, that's, affecting your health and your sleep, your body in any way? No? Okay. All right. How do you describe your diet?
It's normal. It's healthy. Fruits and vegetables every day.
Okay, how many meals do you have?
3.
Do you intake enough water?
9 cups a day.
Okay, perfect. Which is really good. And then do you do any form of exercise?
Yes, cardio.
Okay. Cardio or lightweight or even walking is what I would recommend. What's your occupation?
I'm a student.
Okay. And then what are you going to school for?
I'm still in high school.
Okay. Do you have any military history?
No.
Are you sexually active?
No.
Do you since you're not sexually active, whenever you do become sexually active, I just want to educate you that you should get your annual or every 3 years a pap smear. In case a pap smear becomes abnormal, you should get it done every year until it is comes back normal. Okay. And you know what a pap smear is? Okay, perfect. All right, any kind of joint pain that you're experiencing? No. Any body aches, muscle aches, fever, anything like that? No. Okay. I'm gonna go ahead and ask you about your family history now. Going from your grandparents, your siblings, your parents. Do you have any children?
No.
Okay, so basically those 3 criteria is: anyone in your family ever been diagnosed with any kind of heart hypertension, stroke, or heart attack?
No.
Are all your grandparents alive?
No.
What did they decease of?
Old age.
Okay. What about your parents? Are they alive?
Yes.
Do they have any health problems right now?
No.
Okay. What about your siblings? Are they alive?
Yes.
Do they have any health problems?
No.
Okay. So going past that, anyone in your family you said has not had any cardiovascular issues.
No.
What about any respiratory issues? Any asthma? Any emphysema in your family?
No.
COPD?
Nope.
Okay. Anyone in your family ever been, or yourself ever been diagnosed with any seizures, any headaches?
No.
Anyone in your family ever been diagnosed with any kind of diabetes or diverticulitis?
No.
Anyone in your family ever been diagnosed with constipation?
No.
Any obesity in your family?
No.
Anyone ever been diagnosed in your family with arthritis or joint pain?
No.
Any muscle aches?
Nope.
Anyone in your family ever been diagnosed with any continence issues?
No.
Any frequency in urinating? What about any kind of cancer in your family?
No.
Okay. Any breast cancer or lung cancer?
None.
Okay. So that completes our family history. I'm going to go ahead and ask you about your social history. What do you like to do at your free time?
I love to read.
Okay, sorry, let me go back. I missed a thing. For your family history, do you have any family history with anyone in your family used any tobacco, any smoking, any substance abuse?
No.
Any drug abuse?
Nope.
Okay, anyone in your family ever had any changes in their vision or vision loss or hearing loss?
No.
Okay. All right, now we can go and move down to your social history. So what do you like to do for fun?
Reading.
Okay. And then you said you're going to school. What are you going to school for?
Yes. Still a student in high school.
Okay. Anyone in your family or yourself had any military exposure?
Nope.
No. Okay. Have you experimented with any kind of recreational drugs?
No.
Any alcohol?
No.
What about tobacco?
No.
Okay. So as far as your social history, and I'm probably missing a lot of things. That's okay. Any skin changes with you?
No.
Okay. Any kind of you've seen any rashes or anything abnormal? No. I don't see any signs of cyanosis. You look warm, pink, and dry. What about your social history? Let me. Sorry, well, a little confused. Okay, so I'm gonna go ahead and just start off by asking you personal questions about your health, current health. Go ahead and tell me, have you had any headaches? Have you had any changes, any headaches, any seizures?
No.
Have you had any change of vision or hearing?
No.
Have you had any experience any runny nose or anything bothering you with your mouth? No. Do you have problems swallowing or chewing?
No.
Okay. Do you have I already asked you all your immunizations. Yes, I did.
Yes.
Sorry. Any chest pain or any time you feel like your heart is fluttering or your heartbeat is too fast?
No.
Okay. Any muscle pains? Any joint pain? with you?
No.
Okay. Back pain?
Nope.
Leg pains?
No.
No. Okay. Any time you feel like you're experiencing shortness of breath?
No.
Okay. So sorry, I'm gonna go back to your family history and yourself. Anyone diagnosed with any kind of genetic diseases such as cystic fibrosis or Huntington disease?
No.
Okay. I'm just gonna keep on, going back and forth because some things are coming to me, some things are not. I'm trying not to look at my notes. That completes our hopefully family. So no respiratory issues for you. What about any abdominal issues? And do you feel like you're constipated?
No.
Do you have bowel movements often?
Yes.
How many times a day?
Twice a day.
And then can you tell me the texture?
Solid.
Okay, solid
Not
or
too solid. It's
okay.
like regular.
Soft?
Yeah, solid.
Okay,
Solid.
soft. And you said you go twice a day.
Yes.
Do you still see any blood or any?
No.
Okay. Once again, I'm gonna go back. Have you experienced any? Anyone in your family ever been diagnosed with any kind of bleeding disorder, anemia, or thalassemia, things like that?
No.
Okay. What about for yourself? Do you bleed easily or do you bruise easily?
No.
No? Okay. Going down to your not endocrine, we've already done diabetes and diverticulitis. I'm going to go ahead and move down to your lower body. Any urological issues, any UTIs?
No.
Do you get frequency pain or pain when you're urinating?
No.
Okay. I'm going to go ahead and move down to your, and you said you have two bowel movements a day. You drink plenty of water?
Yes.
Okay. Any joint pain, any muscle aches for you? Okay. So that completes kind of our urological exam. Let me just take a look at this. Abdomen, spine. You said any problem swallowing?
No.
No problem swallowing. All right. Do you feel like do you lose balance if you're walking?
No.
Do you fall on one, toward one side?
No.
Okay. I'm gonna go ahead and I'm gonna wash my hands. I'm gonna go ahead and start off with my physical assessment now. And basically, let me just clear my hand. Clean my hands. I've cleaned my hands. I'm gonna start off from the head and kind of move my way down to your feet. If at any time you have any questions, or you feel like you want me to stop, please let me know. And I will go ahead and stop. I'm going to go ahead and start off by assessing your head. I don't see any lesions. I don't see any missing hair. I don't see any signs of alopecia. I'm just looking at her body. Her body seems symmetrically even. I'm going to go ahead and notify the audience that her posture seems bilaterally equal. She doesn't seem like she's having any hygiene dysfunctions, or she seems like she's clean. There's no body odor coming from her. I'm assessing. There's no signs of cyanosis. Her lips are pink, and her skin is warm to touch. There's no signs of clubbing, so I know she's not experiencing that. I'm just assessing her fingers. I'm going to check her capillary refills. It's less than 3 seconds. I'm checking her skin trigger. It's less than 1 second or even half a second. There's no signs of hyperpigmentation on her face. I don't see any rashes once again. No arrhythmia, no redness. No really dark circles either. I think it's just genetics that you have. Other than that, so now I'm going to go ahead and move down and check all her cranial nerves. I'm going to start off with cranial nerve 1, which is your olfactory nerve. And I'm going to have you close your eyes, and you're going to tell me what you smell. Close one side of your ear. Okay.
Orange.
All right, and then close the other side of your... Sorry, I said ear.
It's
Or the
okay.
side of your nose.
Rose.
Perfect. Okay, so her olfactory nerve, which is her cranial nerve 1, is intact. I'm going to go ahead and just kind of assess your nose, check for patency, check to see if I see anything obstructing in your nose. All right, I see a nasal mucosa is nice and pink and moist. I don't see any dryness. I see that her septum is not deviated. It's in the midline, so that's good. Next, I'm going to go ahead and check for your cranial nerve 2, which is your optic nerve. And what I'm going to have you do is I'm going to go ahead and have you close one side, cover one side of your eye, and read the very last line. Just to notify my instructor that for the purpose of the video, I'm just standing really close just to stay within the frame, video frame. Normally in the clinic, I would have her stand 20 feet away and I would be having her read the very bottom line. So go ahead and cover one eye and read the very smallest line you can read.
LTFPH.
And cover the other line.
LTFPH.
All right, so this goes to show that she has a 20/20 vision. And then go ahead and leave both eyes open. Go ahead and
LTFPH.
perfect. So her optic nerve, which is her optic nerve number 2, is intact. I'm gonna go ahead and check her for perla to see if there is her pupils are round, reactive to light. I see that her pupils are dilating. They're reactive. They're round. I'm checking both of her pupils, her right and her left, with direct and indirect light, and I see both of them. They're both dilating and constricting as I'm shining light in them. I'm going to go ahead and take my ophthalmoscope. I'm going to do from my right eye to her right eye, and I'm just going to check her eye and look for in her iris for the red reflex and try to see what else I can see. I'm placing my hand right here, and I'm going to stick my pinky out just for her safety and my safety. And I'm looking at her eye. I'm going in. Go ahead and look straight for me. I see the red reflex. I see her sclera is nice and white. She doesn't have any signs of jaundice. I see that her blood vessels are not protruding, or they're not. They don't show any signs of edema or any irritation. What else do I see? I see the optic disc. Again, everything seems normal. This test I would do to both sides, but for the sake of time, I'm just doing it to one side for the video. I would assess both sides bilaterally. So her irises, her optic nerve is intact. I'm going to go ahead and do the accommodation, which is checking for your cranial nerve 3, 4, and 6, your abducen, your oculomotor, and your trochlear nerves, okay? So go ahead and follow the pen, and keep just with your eyes, you're going to follow the pen. Horizontal movement is showing that she has movement with her abducen, and then lateral is showing my oculomotor, lateral and medial, and then go ahead and bring it down. I also checked her eyes for any nystagmus. I didn't see any jerking of her pupils, so that just goes to show me her eyes that she doesn't have any signs of nystagmus. So cranial nerve 3, 4, and 3 and 6 are intact. I'm going to go ahead and do your trochlear, and I'm just checking your inside of your ear as well. Bilaterally, her ears are not showing any signs of drainage. There's nothing, protruding. I'm going to go ahead and change my my lens out, now doing my other scope. And I'm just going to look in her eye. In her ear. And I'm pulling her ear up and back. And I'm seeing a very clear internal canal and then also an external canal. And I see the pearl of gray. Once again, just a little bit of wax, nothing obstructing. I see the cone of light. This is her right ear, so I see the cone of light over at 5 o'clock, and then for the left ear, I would see the cone of light on the left side. I would see the cone of light at 7 o'clock, and on the right ear at 5 o'clock. No arrhythmia, nothing abnormal, no redness, nothing irritating her ears. So this covers our cranial nerves 3, 4, and 6. Next, I'm going to go ahead and have you do ah for me. All right, you can go ahead and stop. This is checking her cranial nerve 5. Cranial nerve 5 is intact. I'm having her say ah. Go ahead and swallow for me as well. This checks for our cranial nerves 9, 10, and 12, hypoglossal, vagus, and our glossopharyngeal. Once again, you're going to go ahead and stick your tongue out and then push this, and then push this, lift your tongue up, and down. Okay, so this goes to show me that her tongue is strong. She has strength in her tongue, which is her hypoglossal, and then I'm going to go ahead and have her do the, I've seen her swallow. Since I assessed your ears, I'm going to go ahead and check for your cranial nerve. I'm sorry, I'm jumping around. Cranial nerve 7. 7, go ahead and wrinkle your forehead. Go ahead and make a frown. Go ahead and smile. All right, so this is checking for cranial nerve 7. It's intact indeed. I'm going to go ahead and move down to your cranial nerve 8, which is your cochlear. And we're going to do the whisper test, we're going to do the Weber test, and we're going to do the Rhine test. I'm going to go ahead and whisper something. Cover your ear for me.
Boo-boo.
Okay, tell me what I say again. Cover that ear.
Chocolate.
Okay, so her hearing is intact. Cranial nerve 8, cochlear nerve is intact. I'm going to go ahead and do the Weber's test now. Tell me when you don't hear anymore.
Stop.
All right, so the Weber's test shows that she, it's a negative test or a positive test, I would say, so you're good. Next, I'm going to go ahead and do the Rhine test. Let me know when you don't hear it.
Stopped.
All right, do you still hear it?
Yeah.
Okay, and then we're going to do the Rhine test on the opposite side.
Stopped.
Do you still hear it?
Yes, I do.
Okay, so cranial nerve 8, which is her cranial nerve 8, which is a cochlear nerve, it is intact. I'm just going to move my things closer. And cranial nerve 8 is intact. I'm going to go ahead and move down, and we're going to do your cranial nerve. We've done 1, 2, 3, 4, 5, 6, 7, 8 we've done, and we're going to do the 9, 10, and 9, 10, and 12, which we've already done. I've already had her, I've checked her tongue for deviation. I've checked her uvula. Let me just go and assess your mouth while I'm here. Go and open your mouth. All right, I see a very pink mucosa. I don't see any missing teeth. Go ahead and lift your tongue up for me. Her gums are nice and pink. They're not showing any signs of swelling. Her soft palate and hard palate I can see. Again, no signs of, okay, you can go ahead and close your mouth. No signs of bacteria or buildup. I had her swallow, so that was her cranial nerve, the hypoglossopharyngeal, vagus, and the hypoglossal. Tongue, gag reflex. Oh, and then also I would have her do the gag reflex, but for the sake of the video, I'm not gonna have her do the gag reflex. But the gag reflex is also checked in 9, 10, and 12. Okay. So last cranial nerve that's left is our cranial nerve 11, and I'm gonna go ahead and have you do the shoulder shrug test. Go ahead and against my resistance, go and push up on my shoulders. Perfect. And then just go and push up on my shoulders without any your help. Perfect. All right. So her cranial nerve 11, for her shoulders shows that bilaterally her shoulders have strength. So now we're gonna go ahead and move down, basically down. I'm gonna check your, I'm gonna assess for her lymph nodes. Before I do that, let me just go ahead and have you turn this way for me. And I'm gonna palpate her trachea to see if her trachea is midline. Go ahead and swallow for me. All right, I feel for her Adam's apple. Well, actually, I can't really feel for it, but her trachea is midline. There's no deviation. I'm checking. I don't feel for any signs of gout, any signs of any masses. No masses present. There's no nodules, no cysts, nothing abnormal with her, and she's not reporting any pain or tenderness. And nothing is bothering her with her trachea. So now I'm going to go ahead and have you move toward me, and I'm going to assess for all of her lymph nodes. And let me just make sure I'm still recording, because that would be so bad. Okay, I'm going to go ahead and move down. I'm going to assess for her lymph nodes now. Go ahead and tell me if you feel any pain or any tenderness. I'm going to start off by doing her preocular, auricular, and your post-auricular. So they're located right over here. Any pain or tenderness? All right, moving behind her ears for the post-auricular. Any pain or tenderness?
No.
All right, we're gonna go and move down to your occipital now. Look down for me. All right, any pain or tenderness?
No.
Okay, and then I'm gonna go ahead and do her tonsillar lymph nodes, which are right here. Any pain or tenderness?
No.
I'm gonna do her submandibular. Any pain or tenderness?
No.
All right, and then your submental. Any pain or tenderness?
No.
All right, and then we're gonna go ahead and move down to your anterior and posterior clavicular, which are all right here. Any pain or tenderness?
No.
All right, and then your post. Any pain or tenderness?
No.
Perfect. Okay, and then lastly, we're gonna do the supraclavicular, which is right here. Any pain or tenderness?
No.
All right. So no pain or tenderness reported with her lymph nodes. We're gonna go ahead and move down. I'm just going to assess for her chest wall, and I'm going to check for her respirations now. I'm giving her a respiration of 17. She's not really experiencing, it doesn't look like she's putting in too much effort breathing. By the way, I did check her blood pressure, all her vitals before coming in. Her blood pressure was 120/70. I had her, we checked it sitting down and standing. And then I checked her respiratory rate, which was 17. Her temperature was 97.2. Pain, she reported a pain of 0 out of 10. Her O2 was 99. And I think that's it. I must have forgotten something. But that's okay. All right, so those were vitals. And then I'm going to go, and then what's your height?
5'5".
And what's your weight?
109 pounds.
Okay, so according to that, her BMI would be 21.5. So we calculated her BMI. Now I'm gonna go ahead and I give her the AP. I'm going to do her respiratory exam now, thorax, lungs, respiratory exam. I'm giving her a AMP ratio of 1 to 2. I'm just going to start off by just inspecting her chest wall bilaterally. It's rising and going down at the same time. I'm going to do my respiratory excursion. Go and take a deep breath for me. All right, I'm placing my hands right below her rib cage and let go. And my hands rise and fall at the same time, showing me that she has bilateral respiratory expansion with her breaths. I'm going to go ahead and you're going to sit up for me, and we are going to palpate. I'm going in between her intercostals. Let me know if you feel any pain or any tenderness, anything bothering you anywhere.
No.
Normally, you would do this exam under clothes, or I would have her in it when she were to come into the clinic. I would have her remove her shirt and just have her wear a sports bra or her regular bra and do this exam, just so I can get a proper understanding of it. And I'm going to go ahead, and she didn't report any pain or tenderness, so I'm going to go ahead and percuss her chest wall now. Once again, I'm feeling for anything abnormal, which is any dullness or any kind of I can only feel for a resonance, which is actually normal. And then I'm going to go ahead and do her diaphragmatic excursion as well right here. So wherever I feel that her diaphragm kind of stopping or kind of getting less, I'm going to go ahead and measure that space from the point I didn't hear the resonance to the point I did, and I have a measurement of 3 centimeters, which is actually considered normal. It's within normal limits. Next, I'm going to go ahead and check for basically, I've already percussed her chest wall. I'm going to go ahead and listen to her respiratory rate. And with this, I would normally listen with both the bell and my diaphragm, but for the sake of the video and the sake of time, I'm only listening to it with my diaphragm. And I'm listening to it over her clothes for her own privacy. Every time my stethoscope touches you, please take a deep breath in and out. Okay, I heard bilaterally clear breath sounds. Nothing abnormal. No wheezing was found. There was no rhonchi. Bilaterally, I heard clear breath sounds. I'm going to go ahead and have you move to the back now. Or show me your back. Again, I'm going to do the same thing to the back side of her chest, of her lungs as well. I'm just going to palpate at first. I'm checking for any pain or tenderness. If she reports any pain or tenderness, which is none. I'm checking for any cysts, any masses protruding, which is she's telling me none. And then now I'm going to go ahead and check for a respiratory excursion. Go and take a deep breath in for me, out. All right, my hands are bilaterally moving. Going to do the diaphragmatic excursion for right here as well. And this is where it stops. Again, 3 centimeters, which is considered a normal, or 4 centimeters, which is considered a normal finding for her. I'm going to go ahead and do percuss her chest wall from the posteriorly. I hear resonance in all of the quadrants of the posterior chest wall. Same thing again. I'm going to go ahead and listen to her breath sounds. Perfect. I heard bilaterally clear breath sounds. You can go and turn around. I didn't hear anything abnormal. There was nothing unexpected with her breath sounds. Bilaterally clear upon auscultation, and no consolidation. It was no fluid buildup or anything like that. No signs of pneumonia. Go ahead. I'm going to have you lay down now. You're going to put your head right here, and then I will give you. I still have to do this. We're going to go ahead and assess for your abdomen now. Go ahead and come closer below. Yep. Perfect. Alright, I'm making sure she's in a comfortable position. That way she doesn't report any pain or anything like that for me. I'm taking my notes that I wrote earlier, setting them right here. Haven't really looked at them too much, but okay, I'm going to go ahead and assess for your abdomen now. Go ahead and lift your shirt up for me. I'm looking for any signs of scars, any pigmentation, her contour of her skin. I don't see any lesions. I don't see any bumps. I don't see any bruising. I don't see anything protruding, which should alarm me to stop the exam. And again, contour of her abdomen is bilaterally equal. No signs of pigmentation. Nothing abnormal. So I'm going to go ahead and start off by auscultating. And with the auscultations, I'm just basically assessing for hearing your breath, your bowel sounds, okay? I'm starting at the right lower quadrant, and I'm just moving my way around. For the sake of time and for the sake of the video, I'm just moving very fast. Normally I would listen to in each quadrant for 15 to 20 seconds. I didn't hear anything abnormal in her bowel sounds. I heard normal and active bowel sounds, not hyperactive or hypoactive. You want to do the auscultation of the, always want to do inspect and then auscultate your abdomen, just so you don't throw off any of the bowel sounds. If you palpate or you percuss before you auscultate the abdomen, it always gives you not within normal limits bowel sounds. Now I'm going to go ahead, I only use my diaphragm, but I would, for the sake of, an actual exam, I would use my bell and my diaphragm for the stethoscope to listen to the bowel sounds. I'm going to go ahead and listen to her aortic pulses now, which is located right above your umbilicus. No bruit found. No thrill. I'm going to go ahead and move down to her renal pulses now, renal artery. No bruit, no thrill found. I'm going to go ahead and move down to her inguinal artery. Once again, no bruit, nothing abnormal. I'm going to move down to her femoral. No bruit, nothing abnormal. Okay, So all of her arteries and all her pulses are, show no signs of nothing abnormal. Now I'm going to go ahead and start off by palpating your abdomen. I'm going to move this up because I need it, and I'm just going to sit right over here. I'm starting off in the right lower quadrant, and I'm going to go ahead and percuss before I palpate. Let me know if you feel any pain or tenderness or anything like that. I hear tympani in all 4 of her quadrants, which is actually considered normal. And now I'm going to go ahead and do light palpitations. Sorry, are you okay?
It's ticklish.
Ticklish? Okay. Alright, sorry. Light palpitations, along with deep palpitations for the sake of the video, for the sake of time. And I'm basically feeling for anything protruding, her reporting any pain or tenderness. She's not reporting anything, so now I'm going to go ahead and palpate for her liver. I'm going to percuss her liver. I feel her liver is in the right upper quadrant, so I'm going to percuss it and check for her liver span. Her liver span is about 6 centimeters, which is actually considered within normal limits. I'm going to go ahead and feel for her, or percuss for her spleen, which is located in the left upper quadrant. I feel like I can feel the dullness where the spleen is, so now I'm going to go ahead and have her just I'm going to try to palpate for her spleen. I don't feel for her spleen, which is actually considered a normal finding. You're not supposed to feel for the spleen at all. I'm going to go ahead and move down and palpate for her liver. Take a deep breath in. Let it out. I feel the edge of the liver. I can feel it. That's actually considered normal. I'm going to try to feel for her kidneys, which are located in the lower back. I don't feel for them. Usually that's within, depending on anatomically on a person's body, that's actually considered normal. I'm going to go ahead and percuss over your bladder. I feel tympani, which is just indicates that she probably used the bathroom before. I'm going to go ahead and palpate over the bladder. Any pain or tenderness? No. I'm going to palpate over her inguinal lymph nodes. Any pain or tenderness? No. I'm going to palpate over her femoral lymph nodes. Any pain or tenderness? No. Okay, perfect. All right, so that completes our abdomen exam. I'm going to go ahead and have you sit up for me. You're going to turn around and we're going to do a CVA tenderness. Check for CVA tenderness. I'll leave that sitting right there. Oh, sorry, I forgot to check. I'll check it. Actually, can I have you lay down before I forget? Earlier I was supposed to do the observe for her JVD, but since she wasn't laying down, I didn't want to do it. So go ahead and look that way for me. And I'm just assessing for her JVD. I feel the pulsing, but you're not supposed to actually feel for the pulse. So I see it rising and falling, so that means that she has, I can see her JVD pulse. So go ahead, now you can sit up for me and turn that way. I'm going to check for her CVA tenderness. Alright, she's not reporting any pain or tenderness, and she didn't just jump right off, which is very obvious in a patient that has CVA tenderness. Perfect, so you can go and turn around for me now. And after this, we're going to go ahead and I'll check for your upper extremities now. Okay, let's move to upper extremities. So with upper extremities, I'm basically inspecting her shoulders. I'm going to go ahead. I see symmetrical. Both shoulders are bilaterally equal. She's not like off to one side versus the other. She's not reporting any, pain or anything abnormal. She didn't come with any concerns as far as her posture. Her posture is straight, upright. Her mood is also good. I forgot to mention that earlier. She's very cheerful. Her attitude is positive. Sorry, I know this is way out of context, but what's your race?
I am Indian.
Okay, and then what's your nationality on your passport?
I am American, United States.
Okay, perfect. Sorry, I was just like, it just occurred to me. Yeah. Alright, so I'm going to go ahead and palpate for her shoulders now. And I'm just going through the bicep groove and checking to see if she reports any pain or tenderness. Then I'm going to go to the fossa, the supraclavicular fossa right here in the back. Any pain or tenderness? No. Okay, feeling for any cysts, any masses, anything protruding out of her shoulders. She doesn't report anything, so I'm going to go ahead and move down to her elbows now. Normally you would assess both sides, but for the sake of the video, we are only going to assess just one side. And I'm just feeling her both bilaterally, her elbows are equal. I'm just assessing her elbows, checking for the golfer's point or the golfer's elbow on the medial side, and then checking for the tennis elbow on the lateral side of her elbow. While I'm here, I'm going to go ahead and do palpate for her. Is that bothering you?
No.
Epitrochlear lymph node, and I can feel it. It's very strong. Usually it is epitrochlear. Usually you're not supposed to feel it that much, but I feel like the epitrochlear point. While I'm here, I'm going to go ahead and just assess her axillary lymph nodes. I don't feel any cysts, no form of masses, nothing protruding in her axillary lymph nodes. Now I'm going to go ahead and just continue with my elbow or her upper extremities. I'm going to go ahead and do her palpate her wrists. Again, I don't see any deviation in her wrist. I don't see anything abnormal. I'm going to go ahead and move down to her fingers. There's no sign of clubbing. There's, her capillary refill, again, as I've checked, is less than 3 seconds. I'm going in between her metacarpal phalangeals in between her fingers and checking for any cysts, any masses, anything protruding. Are you any pain or tenderness? Okay, so she's reporting no pain or tenderness. So now we're going to go ahead and do is we've palpated your upper extremities. I'm going to pretend like I did both sides, that side as well. And I'm going to go ahead and do some range of motion with you, okay? Go ahead and lift your shoulders up for me. All right, and then all the way down past your, perfect. And then go ahead and bring them up. All right, and then now we're going to go ahead and you can move them to the side. Yeah. Okay, perfect. All right, so go ahead and bring your arms in now. We're gonna go ahead and do range of motion for her elbows. Go ahead and, go ahead and do this. And then lift your arms out and then try to bring your arms in. So her upper extremities are bilaterally equal. Squeeze my fingers for me. All right, fingers are also bilaterally strong. And then I'm gonna, I don't know why I'm doing that. Okay, lift your fingers up and then bring your fingers down. Okay, and then do the same thing with your hands. Bring your hands up and then bring your hands, up now. Perfect. Okay, so her upper extremities, her shoulders, her elbows, her wrists, and her fingers all are bilaterally strong and equal on both sides. She's not showing any signs of, one side being stronger than the other or anything like that. No cysts, nothing was palpated during her upper extremities. So now what we're going to do is I'm going to go ahead and move down to your lower extremities. So we're going to go ahead and we don't need this pillow anymore sorry. I'm going to go ahead and have you lift your legs this way. Perfect. All right, you're going to go ahead and lay down and I'm going to palpate I'll leave this paper over here somewhere. I'm going to go ahead, put your head down so you're relaxed. And, sorry, is this in the way? All right, so I'm going to go ahead. I'm checking for symmetry in her lower extremities. I see that, both her hips, her knees, and her ankles and her feet are bilaterally equal. There's no signs of swelling. There's also no signs of swelling in her upper extremities, her shoulders, elbows, and her wrists. There's no joint deformities either found. And then she also didn't report any muscle ache or joint ache. Once again, no swelling, nothing abnormal, no signs of edema or anything like that. So with that being said, I'm going to go ahead after inspecting her hips. I'm going to go ahead and palpate. So go ahead and move to one side. You can move toward me or that side. That's fine. I'm going to go ahead and palpate her hips, and basically I'm feeling for that greater trochanter. And I can feel it, it's very obvious, and I'm just going to go ahead and move down, and I can feel her, through her hamstring, I can feel her iliac bone, or iliac crust. Any pain or tenderness?
No.
Okay, so she's not reporting any pain or tenderness. I'm going to go ahead and have her get on your back for me, and I'm going to palpate her knee now. Again, I'm just doing one side for the sake of the video. I'm going to go above her suprapatellar groove, and I'm just assessing any pain or tenderness.
No.
I'm going on the sides of her her patella, any pain or tenderness?
No.
I don't feel for any, there's no fluid buildup, anything access. I'm going to go and go behind her popliteal. And any pain or tenderness?
No.
Okay, and I'm going to go in front of her patella, which is where her tibia is. Any pain or tenderness?
No.
Okay, I'm going to go and move down and assess her malleolus, her ankles on the inside. Any pain or tenderness?
No.
I'm going to go and do the outer. Any pain or tenderness?
No.
And I'm going to go ahead and move down to her finger, her phalangeals, digitalis, phalangeal in between. And I'm feeling for the, any masses, any pain or tenderness?
No.
No pain or tenderness. I'm going to go and do her fingers last, or her toes last. Any pain or tenderness?
No.
Perfect. So she's not reporting any pain or tenderness. I'm going to go ahead and do the range of motion for her hips. Go ahead and bring your hips all the way out. Yep. Or your legs out. Yes. Okay. And then go and try to push your legs in. And then go ahead and make a big circle with your, all the way up with your leg all the way up. Go all the way around. Up. Yes. Like that. And then go ahead and do the same thing with the other side. Perfect. And then I'm going to have you lift your legs all the way up in the air, straight. Perfect. And then bring it down, come toward me. Go ahead and lift my hands up. Go ahead and push my hands down. Bilaterally, strength is equal, and she's strong on both sides of her lower extremities. Go ahead and sit up for me. We're going to go do the reflexes now. I'm going to go and do all the reflexes all together from her upper extremities to her lower extremities. And basically we're going to go ahead and just do it on one side at a time. I'm going to do the brachioradialis reflex first. All right, her brachioradialis pulse is pretty active. We're going to go and do the bicep. Relax your arm. All right, and then I'm going to do the tricep reflex. Relax your arm. All right, okay, and then now we're going to go and move down to our patellar reflex. Go ahead and move down. All right, I'm going to go ahead and assess for her Achilles. All right, and then now I'm going to go ahead and assess for her Babinski's reflex to see if her toes fan out. You don't like this one, huh? All right, and then she has, active Babinski. She's not showing any signs of flat foot, which is where I would indicate to see like orthopedic, but she's not showing any signs of that. Again, no arrhythmia, nothing abnormal found in her lower extremities. I've already checked all her reflexes. I'm going to go and check your pulses. I'm checking your temporal pulse right here. While I'm here, I actually forgot to feel for your maxillary sinuses. And I'm going to go ahead and feel for your frontal sinus. Any pain, tenderness, anything abnormal? Okay, I'm going to go ahead and move down. The carotid pulse is the one pulse that you're not supposed to feel all together, equally. So I'm going to go ahead and just find her carotid pulse. Oh, it's very strong. So that's a good thing. Her temporal pulse, I would give it a grade 2+. Her carotid pulse is also a 2+, very strong. I'm going to go and move down to her radial pulses, radial ulnar pulse. Very strong as well, bilaterally strong, grade 2+. I've already checked her femoral pulses. I'm going to go and do her popliteal pulse. I would give it, it's bilaterally strong, +2. I'm going to go ahead and assess for her dorsalis pedis pulses. Again, very strong, bilaterally strong, equal. I would give it a +2. So with that being said, I actually forgot to check your tactile firmitis to see the vibration. Go ahead and give me a 99 every time.
99, 99, 99, 99.
Perfect. So I felt equal vibration on her anterior side. I would do the same for the posterior side, but just for the sake of time, I only did it to one side. With that being said, I've already checked all your pulses. I've already done your reflexes. I'm trying to think what else. I'm going to go ahead and have you check your spine. So go ahead and stand up for me. All right, so now I'm going to go ahead and assess the back part of her her body, which is checking for anything abnormal, anything not equal. I see bilaterally her posture is equal, her shoulders are equal, her spine is midline, her hips, her iliac crests are bilaterally equal. She's not showing one side, longer than the other in any way. I see skin folds in her, underneath her buttocks. So that goes to show that she has, symmetry on both sides of her body. So I'm gonna go and have you bend over for me. You can bend over this way. Okay, so I see that there's, like she doesn't have an abnormal curve, but she's able to provide a good, very front bend for me. That just goes to show that she has range of motion in her spine. There's no signs of scoliosis. I'm going to go ahead and just palpate her spine, and I'm going to use the outer ends of my ulnar sides of my hand. Any pain or tenderness?
Nope.
Okay, no pain or tenderness. And I'm moving all the way down to her lower spine. Once again, no signs of pain or tenderness. Go ahead and stand up for me. Can you give me a back bend? All right, perfect. And then move side to side. Huh? Perfect. All right, so she has full range of motion in her back. I'm gonna go ahead and have you walk now. Can you go ahead and walk toward me? I'm checking for her gait. Her gait is steady. Walk back on your tippy toes. She's not showing any loss of coordination. She's pretty coordinated. Go and walk on your heels now. Her balance is, she's not losing her balance. It's pretty equal. Go ahead, you can sit down for me. I'm just going to take a look at my notes now to see if I missed anything. Oh yeah. One thing that I think I did forget is doing the sensation test for all of her extremities from head to toe. Let me just see if I have time. Okay, we're good on time. Perfect. So I'm going to go ahead and do a sensation test, which is going to check for her, I'm going to do a sharp and dull to see if all of your nerves and your extremities are all intact. Nerves in your extremities are intact. Okay, so I'm going to go ahead and start off at the top. Go ahead and close your eyes. Tell me if you feel a dull or a sharp.
Sharp. Dull. 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 Sharp. Dull.
Say it loud.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. I'm sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull.
Perfect. So that completes our sensation of our to see if all of her nerves are intact in her, cranial nerves, her upper extremities, her lower extremities, and she felt sensation in all of them. Just to go show me that she's not showing me any signs of any numbness in her limbs or in any of her nerves, facial nerves or her extremity nerves. Do you have any questions for me?
No.
Okay, this actually completes our exam, and thank you so much for your time. I'm going to go ahead and turn off the recording. Thank you. Oh my gosh.